Good afternoon. Welcome to the next meeting of the President's Commission on Combating Drug Addiction and the Opioid Crisis. I'm Governor Christie, Chairman of the President's Commission. Welcome my fellow Commission members. I'll tell you up front that both Governors Cooper and Governor Baker could not be here today. I think Governor Baker for certain was phoning in so he can listen. And Governor Cooper had an unavoidable problem in North Carolina, which came up, so he is in North Carolina. I'm going to turn it over to Michael Passante, our designated federal officer. Love that title. Do what you need to do, Michael, and then we'll move on.
Thank you. Good afternoon.
Governor Christie, this is Roy Cooper.
Oh, great to see you, Roy. Thank you for being in, Roy. Thank you.
Yeah, I'm on. I just wanted to let you know I'm here.
Thank you, Roy.
Thanks. Okay.
Good afternoon. I'd like to welcome everyone to the fifth and final meeting of the President's Commission on Combating Drug Addiction and the Opioid Crisis. At today's meeting, we will hear from members of the public who will share their personal stories on how opioid addiction has affected their lives and their loved ones. The Commission will also be discussing and voting on its final report to the President. Members of the public can read a draft of the Commission's final report on the Commission's website at www.whitehouse.gov/ONDCP, and you'll see a page there for the Commission that should be posted certainly by the end of this meeting. On that website, you can also find the agenda for this meeting, minutes and videos of past meetings, and the Commission's interim report. The public is invited to submit written comments on the final report by emailing them to commission@ondcp.eop.gov. The Commission's final report has more than 50 detailed recommendations and is very substantive and useful. We in the federal government look forward to reviewing them and taking actions to try to stop the opioid crisis. I wish to thank Chairman Christie, Commissioners Cooper, Baker, Kennedy, Madras, Bondi, and their staffs for all their work in producing it. It's obvious from the quality of the product that a great deal of thought went into it. I'd especially like to thank Chairman Christie, his staff, and Commission member Bertha Madras for all the late nights they spent drafting and editing recommendations. I would also like to thank the dozens of Office of National Drug Control Policy staff who helped to draft, edit, and research many recommendations and background materials, provided logistical support for all 5 of the Commission's meetings, and handled and responded to the more than 13,000 messages from the public that the Commission received. In particular, I'd like to thank Richard Baum, the Executive Director of the Commission and Acting Director of ONDCP, for all of his work in coordinating the ONDCP staff. Thank you to Deputy Attorney General Rosenstein, Secretary Shulkin, Secretary Acosta, Secretary Carson, and other federal agency representatives for attending today and for all the very important work you will be doing to follow up on the Commission's recommendations. And finally, to all of you witnesses today here who are willing to share your personal stories, thank you for doing that, because by sharing these stories, you're personally helping to dispel the stigma around addiction so that people are more willing to seek help. And with that, I'll hand it over to Chairman Christie.
Michael, thank you very much. I'm going to forego any opening remarks right now. I'll make some remarks later on in light of the number of members of the Cabinet, the President's Cabinet we have here today, and they have some pressing matters to deal with in the afternoon. So I first want to thank all of them, obviously, for being here and turn it over to remarks to Secretary of Labor Acosta. Alex, I appreciate you being here again today as you were at the last meeting, and we look forward to your remarks. Turn it over to you.
Mr. Chairman, thank you, and thank you for accommodating a scheduling conflict that I have coming up. Let me say that first of all, I want to thank the Commission for the work it's done. This is a very, very important matter. It's an important matter for the nation and for the nation's workforce. The President has rightly declared the opioid crisis a public health emergency, and in that declaration, it's really a challenge not just to those of us in government, but to those of us around the nation to really step up and look at this issue in terms of what we can do, but also start to look at opioid addiction through a different light and really take steps to help individuals. Since the Commission meeting 2 weeks ago, I've spoken with several leaders of industry and labor. It focused me on the issue, and as I've met individuals, I've really asked them about this. And the response that I've gotten, the response I've received is really, I think, important to convey. To a person, the response was the same. This is a critically important issue. We are looking at this ourselves in our own organizations. this is something that we are hearing about. I spoke to one labor leader who told me that in one local in particular, they had lost 6 individuals, lost 6 lives because of opioid addiction. Leader after leader told me that this is a problem for their membership, for their business. Just yesterday, I met with Harold Scheitberger, who's the president of the International Association of Firefighters. And he said, I told him I'd be here today, and he said, please convey how much of an issue this is for us and for our memberships. This is something that we are acutely focused on and we are completely supportive of as first responders and as individuals that have membership throughout the United States in every single state. They combat the crisis in the course of their work as first responders. They combat the crisis among their own membership. And something that is particularly important is to convey that this is not something that individuals should be ashamed of admitting. This is something that just needs to be addressed. And so if there's a point that I spoke last time and I provided a lot of information about our own experience with the Office of Worker Compensation Programs and our own experience on the enforcement side. But I wanted to just stop by again today to convey that in just 2 weeks, every organization that I have spoken to about this has echoed the same mission. It's important, it needs to be addressed, and please convey that it's a problem individuals should not be ashamed of, but rather we need to support individuals in coming forward and dealing with this as a nation. And so thank you very much.
Secretary, thank you very much. And I think that you'll see, as you get a chance to look at the final report and the executive summary, that the Commission feels unequivocally about increasing the authority of your department to not only be able to levy penalties where appropriate, but also for you to be able to conduct investigations of insurance companies individually, not having to go through the employers. This is, something that I think is absolutely necessary. We sat here a few weeks ago and listened to the insurance companies, and we appreciated them being here. But I'll also tell you that when all of them are going around the table and saying everything's going fine and we're really making progress, and we have 175 people dying a day, I'm concerned about a disconnect. And the report makes that very, very clear. And we're urging Congress to amend the Parity Act to give you that authority. And I've told everyone, given how long we've known each other, that I am confident that if Secretary Acosta is given the authority, he will use it wisely, but aggressively. And so we are in your corner on this, and we thank you so much for taking the time today and appreciate it, and appreciate the fact that you're talking about it out there. It's very important. So do what you need to do. We understand you're real busy. You got lots of stuff going on, but we appreciate your time today, Alex. Thank you.
Thank you, Mr. Chairman.
Next, I want to go to another member of our panel today who has some pressing scheduling issues as well, but we appreciate him making the time. The Deputy Attorney General, Rosenstein. Rod, I'll turn it over to you for remarks, and thank you for being here.
Well, thank you, Governor, members of the Commission, and I say a special thanks to the family members of the victims who are here with us to share their experiences. And I want to assure all of you that you have no stronger partner in dealing with this epidemic than the United States Department of Justice. Our department is acting with great urgency and vigilance in response to the President's declaration of a public health emergency. Our department is relentlessly pursuing criminals who flood our streets with illegal opioid drugs. We have more than 1,000 active federal investigations involving heroin and fentanyl, and more than half of our highest priority cases are organized crime and drug enforcement task force cases. More than half of those cases are cases involving opioid drugs. We're focused on dismantling illegal drug distribution networks. On October 17th, the department announced for the first time charges against major Chinese fentanyl suppliers. We know the fentanyl is coming in one form or another from China. We also, just last week, announced the establishment of 6 new enforcement teams in the DEA to combat the flow of heroin and fentanyl in some of the states that are hardest hit by the epidemic. The department is committing resources to shut down internet drug dealers because a lot of our victims are ordering these drugs over the internet. On July 20th, the Attorney General announced the takedown of the largest criminal marketplace in illegal drugs. At least 122 vendors on that site were advertising fentanyl, and 238 were advertising heroin for sale through the mail. We also have committed additional resources to target medical providers who illegally abuse their prescribing authority by handing out opioids without appropriate medical need. In August, we created an opioid fraud and abuse detection unit to better use data to identify outlier providers, people who are clearly outside the norm in the extent of their opioid prescriptions. And we've assigned some of our most experienced prosecutors to focus on those cases. Our response to this crisis is not limited to prosecutions. The DEA uses its civil and administrative tools to fight the diversion of controlled substances. And DEA revokes hundreds of registrations each year, preventing reckless doctors and rogue businesses from exacerbating the crisis. Those are just a few examples of the department's commitment to curb the supply of lethal drugs, to punish criminals who exploit people suffering from addiction, and to prevent future addiction. I'm confident that the recommendations of this commission and the support that's generated by the President's order will turn the tide, that we will start to see a reduction in this horrifying upward trend of drug abuse and drug overdose deaths. I look forward to studying the thoughtful recommendations of the commission, and I want to thank you for your service in taking on this challenging task. Thank you.
Rod, thank you very much. Thank you for your assurances that the Department of Justice is with us on this. You will see there are a number of recommendations regarding enforcement in the report, and also a recommendation that there be a drug court in every one of the 93 federal districts across the country. It's an ambitious recommendation, but one that we think, given the success that has happened with drug courts across the states, would be a twofold benefit to the federal justice system. One, to get help to people who need it in order to slow down recidivism. And secondly, it will lower the federal prison population, which I think would allow us to spend those resources on things that I'm sure you and the Attorney General would rather do than putting people in prison who could otherwise be helped through a system like the drug court. So there's that and others, but we look forward to your reaction to it as well. And I can't thank you enough for taking the time to be here a second time. We appreciate it very, very much. Next, I'd like to go to the Secretary of Veterans Affairs. Dr. Shulkin has been here for all of our commission meetings. We appreciate that very much. We highlight, Dr. Shulkin, you should know in the report, the extraordinary work that's being done by the VA already on non-opioid treatments and the success that you're having, not just at the Lewis Stokes Center where we visited in Cleveland, but across the country, and suggest in the report that what the VA is doing can serve as a model for private healthcare providers across this country. And so your hard work and your passion about this issue is being evidenced in the results that you and your agency your department rather is beginning to show. So I'm happy to have you here, Mr. Secretary, and turn it over to you.
Well, thank you, Governor, and thank you for recognizing that because the department has been hard at work at this. I really want to thank the commission. I've truly been impressed and have learned a lot by watching the way that you've run this, Governor, and the way that the commission has brought in expertise from around the country and been open to ideas from almost every segment of the industry, and most importantly from the families and people who have been affected by this. So it's been a true honor to participate in this and to have watched this process, and we're very much looking forward to the report. There are a lot of commissions in Washington that end up with reports. I have a feeling that this report is going to make a real difference. And I also want to thank the President for his commitment and passion to this issue, because I know that that's genuine. I'd like to echo some of the comments of the other panelists so far. I think that one of the outcomes of this report is not only the content. You are getting visibility on this issue and getting people to talk about this around the country and getting all of us to be out there to talk about it. Governor, I don't know how many times I've seen you on TV in the last couple of days. I mean, you were getting out everywhere. That's really important. I think I was most impressed on your interview I saw on Morning Joe, because you were able to talk about the opioid crisis and baseball statistics and somehow went seamlessly between both, and I don't know anyone else that could have pulled that off, but you really did. So I would just encourage everybody here to follow the Governor's lead on this and continue to talk about this issue, because that's the way in which we're going to solve it. And I think all of the commission members have been doing a great job with that. Secondly, again, echoing some of the comments from Brad and Alex, this is making us all look internally. And while we at VA started our opioid safety initiative in 2010, we've been doing good work. This commission has made us refocus and look back and say, can we do more? And of course we can do more, and to do it more aggressively. So we're really refocusing our guidelines to make sure that everybody understands them and follows them. We are looking and going to relook at our approach towards naloxone kits, and now we're going to hear some more about that today. But we think we can do more, and it's really this commission that's helping us take a look at that. And we are going to redouble our efforts to make sure that we touch more people's lives and save lives. So thank you again for participating and for leading this.
Thank you, Mr. Secretary. I appreciate it very much, and your appreciation of my baseball knowledge is more touching than I can even tell you. Speaking of touching, I want to go next to the Secretary of Housing and Urban Development. I got to know Dr. Carson when we were both unsuccessfully challenging the president, and here we are, Ben. But I got to know Dr. Carson and his family during that period of time, and I think he might agree that it's one of those times when you really get to know people very, very well. You're exposed, you're working hard, you're under the same kinds of pressures, and what I got to know about Dr. Carson is that he has not only a great intellect, but he has a great sense of compassion for his fellow human beings, and that comes across every time you listen to him. And so I was thrilled when he said he was willing to be here today to speak on this personally. His department obviously is going to also have a great deal to do with dealing with the populations that we have to deal with in this crisis, and making sure that it's dealt with in a way that's effective and efficient. So having Dr. Carson here today is not only a great personal pleasure for me to see him again, but it's also extraordinarily important for the perspective of the success of this endeavor that we're all going into together. So I turn it over to the Secretary of Housing and Urban Development, Dr. Carson.
Well, thank you so much, Governor, and thanks to President Trump, to other members of the task force for their continuing efforts on behalf of really a lot of people who are forgotten in our society. You know, I, even as a child, had many encounters with the ravages of drugs, drug addiction. Members of my family, cousins who died because of it, people who got into severe legal trouble because of it. In the field of medicine, obviously encountering many people who were addicted to drugs, not because of my prescriptions, but just because it's so easy to manipulate the medical profession into giving you drugs. And a lot of times people, doctors are people too, and they don't want to be bothered incessantly, so it's easier for them just to give you the drugs than to argue with you about the effects of the drug. But I was very pleased that the President declared this a public health emergency. And, I think that brings the kind of attention that we need, because how many people really understand, what 60 to 65,000 lives a year means? That's more people than were lost in the 19 years of the Vietnam War. And you see what a profound effect that war had on our society. So, this really should be having the same kind of effect. But also, from a neuroscience point of view, what drugs actually do to the human brain. It's pretty awful. I probably remember that commercial back in the Reagan years when they said, this is your brain, and it was an egg, and this is your brain on drugs. They put it in a frying pan and watch it be destroyed. It's not too far from reality. And, it frequently starts with something as seemingly innocent as marijuana. And I think we're going to probably hear a little bit more about that from a real brain marijuana expert. But, we think a lot of things are harmless, and they're not. And when we look at the nexus between drug addiction and homelessness, it's pretty significant. And so many of those people under that bridge or, sleeping out in the open are drug addicted individuals. We have to take care of those people. Sometimes there's a tendency to blame them and say it's their fault. I guarantee you 99% of those people if they could push a button and be free of their addiction, they would wear that button out. They would be so happy. It doesn't work that way, unfortunately, because of the changes that occur in the brain. So it becomes important for us as a society to recognize these as people who are severely affected, to provide them a mechanism to get off of the street. That's what I call housing first. And then housing second is you then diagnose why they're in that condition. And housing third is you fix it. And I think, that's where the real compassion comes in, but we must recognize that it's a complex set of things and not a simple thing. And I believe that it's something that we definitely have the ability to get under control. So I want to thank everybody who's here, particularly the commission, particularly you, Chris, for taking on this task. And I think, as David said, it will make a big difference.
Thank you, Dr. Carson. Appreciate it. Next, I want to turn to the person who has been the point person for this commission and for the president on this issue inside the White House, the counselor to the president, Kellyanne Conway.
Thank you very much, Mr. Chairman. I'm really here today to say thank you once and for all to this commission. It's been a huge priority for the president, really from the very beginning. And as witnessed last week in his very powerful address to the nation, he intends this to be a coordinated effort among federal, state, and local governments, non-government organizations, individuals. And I think much of the behind-the-scenes work that this commission has done has gone unrecognized and unappreciated by the general public because it's been such a quiet effort most times. And I'd like to thank all the members of your commission, Mr. Chairman, and to thank Michael Passante, and also to add my thanks to the acting director of the ONDCP, Rich Baum. As you see evidence today in front of you and through the president's remarks last week, this intends to be a full administration-wide effort in combating drug demand, drug addiction, drug supply, frankly, and the opioid crisis. Right after the president took historic steps to address this issue full square, and also did so in a very specific policy-laden way with his wife, our great First Lady, Melania Trump, I think the country heard a call to action for each of us, and recognizing that the problem does affect each of us in some way, some of us more deeply than others, that the solution also has to include each of us. And in that regard, I wanted to just say we obviously have received, Mr. Chairman, the attention of many people in Congress. But in addition to that, I think most importantly, the very next day, the Department of Health and Human Services released a clarification of the HIPAA laws, guidance to healthcare providers, so they may be able to share with family members if a loved one is already suffering from misuse and disorder. And I think that's incredibly important because we have heard many stories here in the White House and all around this country, as you all have, of families who say, "We're so sorry, Mr. and Mrs. Jones, that your son has passed away today. We resuscitated him. We helped him 6 times this calendar year, but the 7th time he was too far gone." And Mr. and Mrs. Jones say, who, what, when, they have no idea. And so to the extent that that HHS has made some clarifications and that can bring some relief, it's a positive step forward. Today, the Centers for Medicare and Medicaid Services will announce an IMD waiver for each of 2 states, New Jersey and Utah. And the president addressed the waivers last week in his remarks as well. Our position is that the number of beds in a facility should never negatively impact the number of patients who could be treated. And when the public hears about that regulation, it just strikes them as one of many that seems unfair and unseemly and unnecessary. So we're very happy to be taking steps in that regard as well. A market improvement on all these fronts really needs something else the president has made a priority, which is a massive education, information, small C campaign across the country so that everyone knows how best to meet these challenges. We must engage and maybe even enrage the public so that folks who have never tried these drugs don't start in the first place. We certainly want to help those who are already suffering, and we want to remove the stigma of addiction and help these individuals to access treatment and begin the process of recovery. This is a complex issue with no easy answer, yet it is a worthwhile undertaking. And I think the work of this commission, which, Mr. Chairman, we look forward to reviewing in full in the coming days and weeks, and We'll rely upon everybody here to help us implement some of those recommendations. It's exactly why we're all here today, so thank you very much.
Thank you, Kellyanne. I appreciate it very much. And I do think, as you mentioned in your remarks, that the event the President hosted in the East Room last week was extraordinary. And when you look at the cross-section of Americans who were in that room and represented and heard the President's words, I've said to folks over and over again across the country that I've spoken to the President about this dozens and dozens of times, and I know his heart, and I know how much he cares about this. And I think last week everybody who watched that speech got to understand exactly what I meant. And so thank you for making that happen. And we as always thank the President for his willingness to do it. We're lucky to have the Surgeon General with us today as well. Welcome. We appreciate you being here before, and I want to give you an opportunity from the perspective of the Surgeon General. We've had some good conversations offline. I'd love to have the Commission hear your remarks regarding our work and the crisis as you see it from the seat of the Surgeon General.
Well, thank you very much, Governor Christie, and members of the Commission for having me here today. I'm honored to be here on behalf of Acting Secretary Hargan and the Department of Health and Human Services, where we've been working tirelessly to combat the opioid epidemic. This epidemic, and make no mistake, it is an epidemic, has had a profound impact on my life and my career, and as such, this is an extremely personal issue for me, as I've shared with some of the folks in this room already. As a practicing physician anesthesiologist who has done acute and chronic pain management, who has prescribed fentanyl, who has prescribed Narcan to folks, and as a public health professional, I've watched this crisis evolve and spiral out of control on the front lines. In addition, I've publicly discussed my brother's own battle with opioid addiction. I've experienced the pain and the struggle that families face as loved ones combat addiction. Justin and I have cried together talking about her son who passed away from an overdose, and my brother who sits in prison right now because of untreated substance use disorder, and how we can share our stories to help make a difference. Yes, we cry together. Yes, we wish it had been different, but we're determined to use these as an opportunity, these stories as an opportunity to lower stigma and to make a difference for everyone else out there. And I think it's important also as we talk about these numbers, and we need to talk about how big the numbers are, but we need to remember that these numbers represent individuals. I talked to Doug about his daughter, Courtney, and I want to thank all of you all for being willing to come and share those stories of those individuals, because that's why it matters. It matters because of the individuals who are suffering. We know the only way to end the opioid crisis is through coordinated efforts across the entirety of communities. During my time as Indiana State Health Commissioner, we faced one of the largest HIV outbreaks the nation has ever seen as a result of injection drug use. We were able to stop the spread of disease and prevent an increase in illicit opioid use by bringing together not just state, local, and federal government, but also law enforcement. And that's why I was so glad you put DOJ on one side of me, the business community. I'm glad you put labor on the other side of me, even though they ran. I don't know where they went. I put on deodorant today, I promise. But I saw that those collaborations across different sectors and different areas of expertise is the only way to succeed. Government, make no mistake about it, needs to help, but cannot do it alone. It's going to take all of us coming together. This administration, and I'm very proud of the President, and I'm so glad that you mentioned last week. I've done interviews too, Governor Christie. Politics aside, it's a powerful thing when the President of the United States shares his personal story about how he and his family dealt with addiction. It's a powerful thing when people come forward and share their stories, and I couldn't agree with you more. I think last week was a turning point. This administration demonstrated its commitment to successfully attacking the opioid crisis in a holistic manner by following the ethos that I subscribe to of better health through better partnerships, and by convening this commission with experts across various sectors and incorporating their expertise into your recommendations. At HHS, we've worked diligently to incorporate the recommendations of your interim report, and up until last week, we had successfully made progress on every single one of those recommendations except the emergency, and glad we were finally able to get to that place. Thank you again very much. Into our 5-point plan that we have at HHS. Last week's the President's memorandum and Secretary Hargan's subsequent declaration of the epidemic as a nationwide public health emergency caused me to to then go out immediately, the very next day, and visit Phoenix House Recovery Center in Northern Virginia, where I got to speak with substance abuse experts and many individuals in treatment. And they were happy. They were pleased that the president said what he said. They said, thank goodness. Finally, people are starting to pay attention and looking at this as a disease and not as a moral failing. The interaction at Phoenix House that impacted me the most was a meeting with a young lady who was in her 20s, who was an honor student, on her way to getting her master's degree, got pregnant, went down the rabbit hole of addiction, and ultimately had a baby who she was worried about being born addicted to substances. Got into Phoenix House and was actually able to recover, and her baby is fine right now. But not only the stories where it didn't go right, but it's important we share the stories of recovery and help folks know that recovery is possible. That story really deeply affected me as a physician and, again, as someone who has seen many people in my career who could have gone down that path. Seeing the joy on her face, her hope, and her new sense of control over her life renewed my vigor for tackling this crisis head on. We must remain dedicated in our efforts, and the work of this commission has been instrumental in guiding and coordinating the response across federal government. We look forward at HHS, I look forward as the Surgeon General to hearing the recommendations that are put forth in your final report today, and I'm eager. Can you tell? Can you hear it in my voice? I'm eager to continue this very important work. So thank you for the opportunity to be here, Governor.
Thank you so much for your hard work and the hard work that I know you're going to put forward in the months and years ahead. It is inspirational to have someone like you in this position, and we're thrilled that you're there and that you bring the life experiences that you bring to this. It's going to help make you a more effective surgeon general, I am confident, and it's going to help the nation by having you there. So thank you very much for being there. I want to turn now to our invited guests. We'll have time at the end for each one of the commission members to speak about their views on this issue and on the report, and to make a final vote as well. But I really want to get to our invited guests. I first want to go to Congresswoman Mary Bono. She served in the House of Representatives from 1998 to 2013. And we have had the opportunity over the years to talk about this issue, and I'm thrilled that Mary was able and willing to come, and I will turn the microphone, Mary, over to you.
Thank you very much, Governor. I feel like I should start my remarks with, hi, I'm Mary, and I'm in long-term recovery as a codependent. But I want to just thank you all very much for having me today, and it's a real pleasure to see, especially my former colleague, Patrick Kennedy. I thank you all for giving your time, your efforts, and your hearts to sparing more Americans from the suffering of opioid use disorder and all that that means. For anyone in public life, few causes offer more direct opportunity to bring hope where there is despair. It's a story of grief and loss that so many families have known. But at least as a nation, we are finally waking up to the gravity of the crisis facing us, and that is a credit to the work of this commission and to the president whose mandate you are carrying out. But I can't begin my remarks, Governor Christie, without recalling your very powerful and passionate words at a town hall meeting 2 years ago. It was just a brilliant speech. You spoke of a law school friend who never found a way out of an opioid addiction. You know firsthand how it feels to see the gifts of someone you care so deeply about go to waste in a very avoidable tragedy. You and your fellow commissioners bring great compassion and knowledge to the subject. And compassion, above all, is needed if we are going to understand the danger of opioid misuse, and as a country, that we overcome it. So I learned early in my life that addressing addiction begins with understanding and empathy. I was blessed to have a very wise father who is also a professor of medicine at the University of Southern California. My mother was an alcoholic, and my dad taught me to see any substance use disorder as a disease, not to judge it as a fault of character. And I learned that addiction can afflict anyone. And sadly, I learned that again when I had children. Certainly with powerful opioids in the wrong hands, it is a recipe for disaster. So some of you may know, maybe you don't know, but I have a son who is now 29 years old. He's an amazing, kind, and courageous person, and I couldn't be more proud to call him my son. But one day when he was a teenager, he called me. I was here on the floor, actually, of the Congress taking votes, and I took his call, and he said, "Mom, I need help. I'm addicted to pain pills." Now, that's not the kind of call a mother ever wants to get, and yet I was so thankful that it came. As many parents know, it's when you don't get that call, that you don't get that call and you never then have that chance to help, and then the worst can happen. That moment, hearing from my son, was hardly the end of our struggles and our fears, but from then on, we were able to face them together. The courage was all his, but what a difference it made that my brave son had our support and felt our love, rather than shame, anger, or stigma. So far from feeling any embarrassment as a member of Congress, I could have been ashamed of the situation. I never felt embarrassed, and I didn't feel any stigma about our family's troubles. Some of that probably goes to Patrick's leadership, too. But I realized I've been given an opportunity, and that opportunity became my cause and my passion. So as a member of Congress at the time, and I tried to use that position for the better, my son and I spoke publicly about the dangers of prescription drug abuse and the path towards recovery. And the more identified I became with the issue of opioid addiction, the more I learned from others about its consequences all across America. Now, there's no way to prepare a family for its own opioid crisis. Many parents-to-be know the book, What to Expect When You're Expecting. But of course, there's no similar guide on how to help a son or a daughter confronting an opioid use disorder. But here's one thing I know for sure. Excuse me. If anything good is going to happen for our loved ones in need of help, it's going to happen in treatment. Only there, in professional care, are they no longer powerless. And by the way, it's where the family is going to get the help they need too. But we don't have to wait for those we love to fall to the very bottom before help is possible. Sometimes the bottom isn't just the bottom, it's actually the end. So in every way we know, being as resourceful and relentless as we can, the goal should be to move the person to that life-saving decision when there's still time, and never, ever, when that magic moment occurs that somebody wants to seek treatment, should they ever be turned away for any reason at all. So for my part, I spend a lot of time in this cause still, and my purpose is very simple to state. I want as many people as possible to escape addiction in the way that my son is doing, by the constant caring support of their families, their friends, their coworkers, and their communities. And as to public policy, by now there's little debate about what has gone wrong, a lack of congressional oversight, many failures of responsibility among various federal agencies. These have all been contributing factors to a very terrible epidemic. But what matters most going forward is the alertness and the decisiveness that this presidential commission represents. And as you help to correct past failures in policy, it will be crucial as well to avoid new ones. A truly national effort will need sustained and adequate funding, and a commitment to best practices that, for example, protects the vulnerable from the scammers that we're now seeing who are popping up in the treatment sector, what we're calling the dark side of treatment. And most important of all, the effort must center on preventing the disease of addiction from ever taking hold in the first place. In the painful journey of addiction, the crucial turn often comes in one clear look at where it's all leading, instead working towards a path of hope in life. Something similar happens when a society looks at a grievous problem straight on. It brings the best minds to address it and commits everything possible to solve it. That's what the United States is doing with this presidential commission, meeting a serious challenge in a very serious way. May your recommendations be turned into law and policy, and may our resolve as a nation be turned into action. Countless lives depend on it. Mr. Chairman, thank you again very much, and I thank you all for your time and your hard work.
Mary, thank you very much. You have been a clear and strong voice on this issue and sharing your story today, and that's really what we want the Commission's final hearing to be. Because in the end, the work of this Commission is about the lives that are lost and the lives that we hope we can save. That's why I thought this was the most appropriate way to do it, and I wouldn't have wanted anybody else to start off those conversations other than you. So, Mary, thank you.
Well, thank you very much. I'm honored. Thank you.
Next, we have Judge Linda Davis, who has also been a leader in this area. We're thrilled to have Judge Davis here. She's from Michigan, in the District Court in Michigan. And, Your Honor, it's good to have you here, and we look forward to your remarks.
Governor Christie and Commission, thank you so much for having me today. My journey with this started almost 13 years ago. I have a young daughter who was addicted to opiates. And I found out, even though I had worked in a system, I was the drug prosecutor for 13 years in our county. I've been a judge for 17 years. I ran a drug court. It was amazing to me how little I knew about how to get somebody help when they really needed it. And I want to focus mainly on the brokenness of the system and the hope that you are giving to parents like me and the other parents that are here today. Back when I started my journey, every door I tried to open was closed, and if it had not been for the fact that I come from a pretty affluent family that had resources, I'm sure that my daughter would not have survived the addiction. It's horrible when a parent is watching on a day-to-day basis their child die, and there's absolutely no resources that you can turn to get help. In addition to that, the stigma of addiction is something that not only she's felt, but I've also felt. And it reminded me of how broken the system is and how much we need to look at almost every facet of it to make sure that we are looking at this comprehensively. As a result, when she was in treatment, I remember one of her counselors telling me, someday you're going to look back at this and realize that it's a blessing in your life. And I thought that person must have been high on drugs because I couldn't imagine that this would ever be a blessing in my life, but it truly has been. It's not only made her a better person, but it's also made me a better person, a better judge, a better mother, and a better member of our community. I started an organization very soon after finding out that she was addicted, called Families Against Narcotics. We started in the basement of a small church, and now we are here in Washington, D.C., being part of a very important discussion. We went from a very small community effort into having over 20 chapters in the state of Michigan, 27 meetings that are held monthly. We work with 4 major hospitals, have partnered with Blue Cross Blue Shield, have partnered with the University of Michigan research team in developing new educational protocols that can be used in our schools that will bring a different approach to teaching kids about drug use and abuse. We oftentimes want to badmouth efforts that have been made in the area of education and say that they don't work, like the DARE program. But what we've failed to do in our country is to have a continuum of care with not only those people that are addicted, but also with those people who are making those important decisions of whether to cross lines that they once knew were bad lines to cross, but somehow with turning into teenagers, they forget those lines and they experiment with things that can end up being deadly. So when we do education for children, we need to make sure that it's a continuum of education, that it starts young, and that we are relentless in giving the same messages over and over again to make sure that those messages are heard. We as politicians know that you've got to get the same message out 7 times before we make an impact in our communities. The same has to be true with addiction. I think one of the biggest areas that we need to really focus on are ways that we can get out into the community to talk about this being a disease rather than a moral failing. It amazes me, we started a program recently through Families Against Narcotics called Hope Not Handcuffs, where we are now partnering with 33 police departments in our state, over 5 counties. And since February, we have placed over 600 people successfully into recovery the same day. And that's a key issue because nobody should be told that they have to wait 2 weeks for recovery to start. Sometimes those 2 weeks are the gap that creates a deadly situation for that young person. So I look forward to this commission making changes that will ensure that when someone walks through one of those police doors, that that day a treatment bed is available to them. And not only that a treatment bed, but that solid treatment is available, and that we have wraparound services where we look at peer coaching as a viable option to being an aftercare for people who are in the recovery world. That we make sure that we have medically assisted treatment that's being paid for by insurance companies for those that can't just get clean with a 12-step program, that there are viable treatment options. We tell people over and over again that are in the world of addiction that if you want different results, you have to do different things. Otherwise, you're just going to get the same results. And yet we work in a community that has done the same thing for decades with addiction. And unfortunately, it has taken an epidemic of unbelievable magnitude to get our attention that we need to change at every step of the way as well, from law enforcement to the judicial system to what Congress is doing, to passing laws that we don't understand, that we don't know the meat of them, and the effect that they're going to have long term. Our group has taken on the task of also educating all of our legislators so that when we present the 25 bills that our commission is putting before them, that they understand the necessity of those laws and the impact that it can make in our community. And we do that through education. Tomorrow morning, I'm flying back to Michigan, and we are doing an all-day legislative day where we tackle this problem at every step of the way so that our legislators can vote intelligently about the bills that are before them. The one thing that I've learned over the last 13 years in dealing with this epidemic is that we are broken at every step of the way, and it is going to take all of us working together as a concerted effort to make sure that we are doing the best job that we can every step of the way. In our community, we started an organization called Operation RX Through FAN that brought every sector of the community together that's being touched by addiction so that we leave no gaps in our community. And that's one of the key issues for this, is that we can administer Narcan and that child can be taken to a hospital. But if all they're going to do is detox and then put them right back out in the community again, we have failed. Even though we have gotten Narcan in every first responder, that person should have a chance at recovery from that moment forward, and we should be relentless until we get them to that point. So it is with a great honor that I'm here today, and I'm really looking forward to learning your recommendations and seeing how this pans out in our community to make a difference for a disease that has been left behind and left out for way too many years. Thank you.
Thank you, Your Honor. Appreciate your remarks and all the work that you're doing as well. Thank you for that. Next, I want to invite to speak Roxana Schwartz. She is from my home state of New Jersey, Lebanon, New Jersey. Welcome, and I turn the microphone over to you.
Thank you very much. I don't want you to be concerned that this is my testimony, but it is my current insurance appeal. My name is Roxanne Schwartz. A lot of people know me as Rocky. I live in Lebanon, the great state of New Jersey. I want to thank Governor Christie and the members of the commission for inviting me here today. I especially want to thank Congressman Kennedy for creating the parity registry, because it has been a great tool for me. I'm very grateful to be here and hope that other families will not have to struggle getting medical care for their loved ones like my family has. I'm a member of the New Jersey Parity Coalition, and I'm the co-chair of the New Jersey Behavioral Health Planning Council. But most importantly, I'm the proud mom of 2 sons who are remarkable and resilient young men who have suffered with substance abuse and mental health disorders for the past 7 years. My husband Keith could not be with me today, but I would not be here without his loving support. My sister died of an accidental overdose at the age of 39 from opioids. And I am a woman in long-term recovery from alcoholism for 35 years. In 1982, when my parents needed to get me the medical treatment that I needed, they did not have to take out a home equity loan. So I was surprised what happened when my kids got into some trouble. I'd like to share just a few examples of the 7 insurance denials for the co-occurring disorders of addiction and mental illness. Stigma and fear have contributed greatly to this issue. I have never met a person that suffers from an addiction that chooses to live in pain and misery. In 2015, one of my sons was discharged from an outpatient program, despite recommendations from the clinical staff that he was mentally unstable and at high risk for relapse. He was so despondent that he attempted suicide 2 days later, after a 48-hour hospitalization. A judge ordered him to more intensive treatment for his safety. The insurance company refused to pay for the recommended inpatient care. We paid for all of his medical care and have lost all appeals for this particular hospitalization. In 2016, my other son was court-ordered into treatment after first responders intervened on his behalf. The insurance denied his care after 12 days of inpatient treatment. The clinical staff stated that he could not be recommended for discharge. I found many examples in the 374-page medical record that showed that he could not be sufficiently stabilized at a lower restrictive level of care, less restrictive level of care. My son is alive today because of the extended care that we paid for out of pocket. He had asthma when he was a child and frequently needed to be hospitalized. Not once was he ever denied the medical care that the doctors recommended, nor was he judged for not caring for his body or blamed for his illness. As recently as this week, he was in the hospital for a few days for a medical condition that is a direct result of his opioid use. But because it presented as a medical issue, there were no questions asked about all the care that was necessary and that he needed. My husband had double knee replacement this year. We did not have to pay for the surgery prior to admission for the hospital. The ambulance transport from the hospital to the orthopedic rehab was paid for, unlike when a patient is transferred from an emergency room to a psychiatric hospital. That is denied. One of our claims for $61,000 was never officially denied. It was kept in a pending status. Even with the assistance of a New Jersey senator's chief of staff and an advocate from our employer, it was never resolved. The last contact from our insurance carrier in May 2015 stated, "You will receive a response to your issues shortly." So even when you have access to care, there are still barriers to treatment. We have spent over $300,000 in the last 7 years for my son's medical treatment. We borrowed against our home, cashed out our college savings accounts, and withdrew money from our retirement fund to pay for their care. The process of filing appeals is a painstaking, time-consuming one. The medical necessity denials are not clearly defined. I have spent hundreds of hours writing letters, researching, copying, faxing, and still lost every appeal, and I'm an informed consumer. My insurance company directs me to the New Jersey Department of Banking and Insurance. However, they have no jurisdiction over self-funded employer-sponsored plans. I have to appeal to the U.S. Department of Labor for resolution. This is the first time that I'm continuing the fight, and the U.S. Department of Labor has had my appeal since March. I reached out to them and asked for an update, but never got a call back. I can't change the past and doubt that any of my insurance appeals will be resolved, but I will not be silent anymore. This is nothing to be ashamed of. My hope is that I can prevent other families from suffering the financial, physical, and emotional toll that my family has. I know that I'm one of the lucky ones. I represent many other parents who have lost their children to these illnesses. And the added stress of fighting for our rights as consumers is unconscionable and frankly fraudulent. Thank you for your time.
This is what I was talking about at the beginning of the hearing, is that we see this frustration at the state level when the state only is able to regulate 30% of the health insurance plans in our state. The other 70% are regulated by the United States Department of Labor, and the Congress has not given the Department of Labor the tools they need to be able to enforce the law and create penalties for companies that are not rightfully paying the benefits that you've paid premiums for over a long period of time. And we've changed the laws in New Jersey, as you know, pretty significantly, so that for those 30%, none of what has happened to you can happen anymore in New Jersey. No pre-clearance, no ability to do a medical necessity review for 6 months after the beginning of treatment. All those things have been changed, but only for 30% of the people in our state. And so that's why the recommendations we've made to give much more aggressive tools to the Department of Labor are so very, very important in this. And both Patrick and I thought that Roxanne's testimony today was extraordinarily important to make sure that everyone understands the importance of those recommendations, that they're not just a regulatory grab. They are something that really makes a huge difference. It can make a huge difference in the lives of people in terms of saving their lives and the quality of life of the family who has to spend $300,000 to be able to make sure they save their children. It's unconscionable. And that's why, to me, last week, listening to the testimony of a number of these insurance executives was, quite frankly, sickening. When they continue to tell me that everything is going great and they're making great progress. It's simply not true. And so we need to be more aggressive, and I'm confident we will be. And one of the things that I know about this president is that that type of conduct by anybody offends him deeply. And anybody who is, I'll put it the way he would put it, putting the screws to somebody like the way that you got it done to you is not something that he stands for. And so I'm confident you're going to have this president's support for those changes in the legislation. And I would love to meet a member of Congress who doesn't want to vote yes on that. I'll be sure to talk to as many of them who want to. So thank you for being here today. I appreciate it very, very much. Patrick, sure.
Real brief. I appreciate you putting the plug in for parityregistry.org, which you used, which anyone in this country can use who's listening to this program as a resource to how to file an appeal. But ultimately, I think the quicker route will be to get articulate, powerful advocates like yours, like you've just demonstrated, to come out and press these attorneys general in these states so that they can weigh in with the insurers within those given states that may have a number of complaints across their health plans. And so this is key. And I'll just finally say that insofar as Secretary Costa, he's wants to meet with us on an ongoing basis on this, so I'll make sure we try to expedite that final appeal that you have when I go see him in about 2 weeks.
Yeah, I got a feeling you'll get an answer. Just a sense I have. Thank you for being here. I next want to turn to Dr. Denny Carisse, who is the Chief Clinical Officer for the Recovery Centers of America. We thank you for being here and look forward to your testimony.
Thank you very much. I'm Denny Carisse, Chief Scientific Officer at Recovery Centers of America, or RCA. I'm also an adjunct clinical professor at the University of Pennsylvania School of Medicine. I want to thank you and the Commission for the opportunity to speak today. I've been in the field working in treatment, research, and to a lesser extent policy for 32 years. What got me started in the field was my own experience with addiction. Thank you. What got me started in the field was my own experience with addiction. It was the era of Studio 54 and freebase cocaine and Quaaludes, and what I learned pretty quickly over 4 or 5 years was that I was not one of those people who could use drugs and still function. So it became a massive problem for me. When I sought help, I was living on minimum wage, and I had no health insurance, and I went to an outpatient program, and they had a sliding scale, and I paid $3.50 for every group, and I paid $5 for every individual session. I didn't know. It was like decades later I realized they were funded by the block grant. I mean, I had reviewed block grants by then, so it was amazing to me. So thank you. Thank you to the taxpayers, by the way. Thank you for the policymakers. You all helped me. You gave me the chance to get back on my feet, so thank you all. I started by going to community college, the only place that would take me, and 9 years later, still sober in recovery, I finished my PhD in clinical psychology and started a NIDA-funded postdoc at University of Pennsylvania. During my 17-year research career, I was an NIH, SAMHSA, and ONDCP-funded scientist. I developed evidence-based practices with NIDA and NIAAA grants. I tracked drug use trends in 300 treatment programs across the country for ONDCP, and I implemented outcome studies measuring treatment success. I also did projects with the UNODC, and I helped start treatment systems in places like Egypt, Nigeria, Nairobi, Iran, Thailand, places that previously had no treatment because their government said we have no problem, right? In 2008, while my oldest stepson was in residential treatment for his substance use disorder, my other stepson, who was 11 months younger, died of a problem with alcohol and benzodiazepines. I'm still very close with my stepson who's in recovery today, and he wanted me to bring this picture for you of my stepson that drank one night like he always did, took some benzos one night like he always did, and was never woke up and was found by his 3- and 5-year-old nephews. Starting in 2010, I shifted from doing research to developing and directing clinical care, first at Phoenix House, a system of 100 great treatment programs, and then for CRC Health Group, which has 120 programs, serving more than 42,000 people a day. So I've had intimate experience with over 500 treatment programs in this country. And my now CEO, Brian O'Neill, called me to come help a startup called RCA. I chose RCA because it was a place like those treatment programs in those other countries where I could start from scratch. I could look at what does the science say is the best we have to offer, both psychosocial services and the medicines, everything that's available. And I could create what the science says is the best treatment, the best way to help people to get into recovery. I was employee number 8, and now we have over 1,000 employees, including sites in New Jersey. So I believe this set of experiences makes me uniquely qualified to make recommendations addressing what President Trump recently called the worst drug crisis in American history, because that's what it is. One of the projects I'm so proud to be part of is called Plan A. I think that Patrick Kennedy dubbed it Plan A to some extent because we realize there is no Plan B, you know? And a lot of it dovetails what you've done, but it wants to achieve 4 goals. Set national standards for high-quality treatment, expand and improve access for Americans, particularly in federal programs, expand treatment capacity, and facilitate compliance and enforcement of parity, all right? I'm particularly proud of this effort because RCA has invested time, money, resources, hired expert health litigation folks to fully develop these amendments. They're ready to implement, and if adopted, they will help all people suffering from this disease, and they will help all treatment programs. This is not an RCA bill. This is a national piece, and so it's not a bill. It's a series of amendments. So setting national standards for high-quality treatment. You know, we know that this is a disease. The field wants to be treated like every other medical health care provider. The field wants to be paid like every other medical health care provider. Incumbent upon that is the field needs to deliver care, document care, show success like every other medical provider, and we need to hold the field to those standards. So covered services under all the federal benefits programs have to be uniform and provided in accredited facilities. What happens when you do that is that you can mandate the use of best practices, not just a select couple of best practices and one-offs, but all the best practices that are out there, that they could offer everything. We do that with cancer patients. We offer them every possible avenue of treatment. Why don't we do that in one place for substance use disorders? It's also a way to demand, to define and measure success or keep score, as was brought up in the last meeting that you had. That this idea that there's no gold standard of what success is has got to change. We've got to have a universal way to measure. It can also establish high-quality standards, not just for residential and outpatient, but for the continuum of care that we know is so important, the length of care that people get, and that it can be include sober living in a structured way, not kind of the wild, wild west of sober living, but a real clear, these are the standards for sober living, have it accredited, and get some really quality treatment. Standards could permit the treating physician to determine medical necessity for minimum periods of time at each level of care, and require federal benefits programs to cover all types of medication-assisted treatment, agonist, antagonist, partial agonist, et cetera, right? So by requiring programs to adopt scientifically derived standards and get meaningful accreditation, we greatly increase the likelihood of success in recovery, cut down on wasteful spending, and this constant cycle in and out of substandard care provided in inadequate doses, because that's what we do now. Okay? 2, expanding and improving access for Americans covered by federal programs. Many people in the country make a point to say to our veterans, thank you for your service. Thanks for your service. But when they get back, if they're lucky to get services, it can be really quality service, but it's tough for them to get those services. So what we want to do is make sure that the veterans can get the services that they need, that they don't have to wait a long time. Because what we know about this disease is that you have to wait a while. When you're ready to go in, you've got to get in right away. This is not a disease that somebody continues to have motivation to get helped with. This is a disease that takes over the brain. So if the nearest VA facility is 40, 50 miles away, or if the wait is an unusually long wait time, we want them to be able to be treated in civilian settings as well. For Medicaid patients, eliminate the IMD exclusion. I know you've already done a lot with that. 16 to 40 is a great kind of bump up, but the reality is that a treatment program at that size will not have the resources to have addiction doctors or to have psychiatrists full-time, which our patients so desperately need. So it'd be even better if we could eliminate it. For Medicare, we want to take care of our older adults and require that states and folks take care of older adults and everybody regardless of age. And for federal employees, we want to recover appropriate dosage and amounts of durations of treatment under all health plans. All right, very quickly, we want to expand treatment capacity. There's a couple ways to do this without allocating any new money, just basically prioritizing current funds to address this public health emergency. One way would be to designate geographic areas of severe distress. So areas where we have unusually high overdose and death rates, call them substance use disorder needs areas. And one way we could encourage investment in treatment is through preferential treatment under the new Markets Tax Credit Program. Another way we could do that is by encouraging investment designating these severe treatment needs areas, targeted employment areas for foreign investors, and expedited visa review under the EB-5 program. The money's already there. If we could allocate a special preference, that would help people invest in developing more treatment programs. Finally, we have to facilitate compliance and enforcement with the Parity Act. And one way to do this is to adopt a uniform kind of multi-step process that we set out for group health plans to document compliance with non-quantitative limits of parity, such as pre-authorization requirements and whatnot. And so this will allow the good guys to show that they're in compliance. And it could also allow sanctions for the folks who are not in compliance. It's 33 years since I started community college, and my passion for helping people who struggle with this disease has not diminished, nor is my commitment to my own recovery. All the homework, including the cost studies and everything, have been done for these amendments. They're ready to go. We've been shopping them around. Let's just get it right this time. I'm so thrilled that I'm here on the day that you're going to say what your recommendations are. We want to get it right with quality, proven, effective services for everybody with this disease, because there's nothing I'd like more than to put myself out of business before I'm ready to retire. Thank you.
Thank you. Thank you for your passion, and we look forward to receiving the documents that you have regarding your amendments, so thank you for that.
Thank you.
Next, I want to turn to Doug Griffin. Doug is here today from Newton, New Hampshire. We are very, very happy that you were willing to share your time and your story with us today. Mr. Griffin, I turn the microphone over to you.
Thank you. First, let me say that I'm honored and humbled to be invited to address this commission charged with such an awesome responsibility. My name is Doug Griffin. I live in Newton, New Hampshire. I lost my precious daughter, Courtney, to an overdose of fentanyl on September 29, 2014. She was 20 years old at the time of her passing. I come today to represent the Addiction Policy Forum's families. My wife is here with me today. She is my rock and stands beside me in all that I do to fight this wave of destruction sweeping across our great land. Without her, I would never have been able to even attempt to begin the fight. At this point, we all know what a family faces when a loved one begins a life of substance misuse, so I want to focus today on what we face after we've lost the battle, and we must go on with broken hearts and broken dreams. My family's story begins on the plains of Kingston, New Hampshire on a cold November morning shortly after Courtney's passing. We stood and told a small crowd of maybe 200 about our struggle and urged the public to learn quickly of the dangers of drugs in our communities. Shortly after that rally, our pastor, Aaron Goodrow, began a monthly service in our small church for those touched by addiction. Aaron has held 23 funeral services over the past 4 years for those who have died from overdose. My wife and I co-host the event and make a dish to bring to the potluck dinner after each service. It's there that we comfort the moms and dads, the grandparents, siblings, and friends of those new to loss. We try to help them learn to manage their grief and begin life anew. At that service, we fill blessing bags. These are small backpack-type bags we fill with toiletries and personal care items. They are distributed to those that are forced to the streets by their addiction. I am a Lion. In 2014 was the year our Lions Club was chartered. My wife and I and our 2 daughters, Courtney and Shannon, also joined the club. Courtney cooked scrambled eggs for around 200 people in our annual fundraiser about a month before her passing. Lion Mike Dolan and I pushed for the formation of a Leo's Club in the Sanborn Regional High School shortly after Lion Courtney passed. Leo's are junior Lions aged 12 to 18. Last week, our 21st member signed on. The Leos helped to set up a local community center and are raising funds to help build a safe place for teens to gather. When asked what they wanted to do as a club, they replied that they wanted to push drugs out of their school. I believe that the only way to get them out is because if no one's buying them, there won't be any reason to have them in there. We are hoping our sports teams will be the first in the state to pledge to be drug-free. Then the cool kids will be helping to let the students know there's no place for drugs in our schools. I have been selected as the Leo chairperson by the New Hampshire Lions, so I travel to cities and towns encouraging them to start Leo's clubs in their school. The Kingston Lions Club has begun an annual golf tournament with the proceeds being donated to treatment facilities and organizations helping those with substance misuse disorder. Our funds become scholarships to help people into treatment and to begin to put them on the path of recovery. My family owns the Green Griffin, a local flower shop, and my daughter Shannon is the world's best florist. Don't take my word for it, you can just ask anyone. The flower shop is the place where people come to talk about their sons and daughters with substance misuse disorder. It's not uncommon to have 2 or 3 families a day in there who eventually get around to talking about their kids. I am the man at your door with flowers the morning after your son or daughter has died from an overdose. I know how these people feel. Excuse me. And there's no worse pain. My daughter is sought after to do these flowers for these victims, having lost her best friend and sister. She always takes time to make beautiful arrangements for these families to help ease their pain. It kills me to see a tear in her eye while she works. My dear friend Anne-Marie Zenfagna has painted up portraits of over 100 souls lost to overdose, and there is never a fee for her art. I have seen her portraits of her daughter Jackie and my daughter Courtney side by side in many events in New Hampshire. I am on the board of directors of the Merrimack Valley Prevention and Substance Abuse Project in Massachusetts. I am there so I can help erase the border between Massachusetts and New Hampshire. There are no borders in this fight. We work to raise awareness across the Merrimack Valley to fight for legislation to improve conditions for the residents of Massachusetts struggling with the substance misuse problem. I was contacted by the Addiction Policy Forum a couple of years ago, and since then I have worked gladly and closely with that amazing team of professionals whose goal it is to save lives. Through the storm of this epidemic, Jessica Nickel has pushed hard to find ways to help others with their struggle. Now with a reach of approximately 4 million, and with thousands of families under her wing, she pushes forward to build a nationwide network of souls committed to a common goal, the saving of lives and the finding of a cure for addiction. I work with families every day, and each person is different. There are different reasons people take drugs, but what I hear most often is that they take them to feel normal and to fit in. Mental health issues lead many people to drugs where treatment and proper medication could allow them to live a normal life. Our daughter begged for treatment and told us repeatedly that she couldn't live this way. Our insurance company denied her at every door. The pills she found so easily at school led to heroin and the destruction of her life. I hear people say that it's their choice and they deserve what they get. Recently, I had a professional call me. He had heard himself playing flag football one Sunday afternoon with his pals. The doctor prescribed an opioid, and after following the instructions on the prescription, he found he needed more. He learned that he was now addicted to them and didn't want to lose his job and ruin his career. What could he do? I'm sure this has happened to thousands across America and across the globe. Should this man be shunned or incarcerated? Our jails and prisons are filled with citizens desperately seeking a $40 bag of what they absolutely must have. There is no consequence they fear. There is only a hole that has to be filled. Without proper treatment, there will be no end to their agony. If any of you think they are injecting heroin to party with their friends, you are wrong. They're dying in gas stations, bathrooms, at the wheel of the car, while driving with their children in the car seat behind them, and alone in secret places they hide from the world. I would find my daughter Courtney curled in a ball on her closet floor, hiding from the world. I had planned to retire next year to spend some time on a riverbank somewhere fishing while playing with my grandchildren. Courtney won't be having any grandchildren or children. And I probably won't be fishing. I will most likely be working with the Addiction Policy Forum and continuing in their fight. Today, I come to speak for those seeking treatment in a world without availability, without insurance coverage, filled with stigma. I testify on behalf of those those my friends raising their grandchildren after the loss of a son or daughter. I testify on behalf of the babies born addicted to heroin and their moms fighting to keep custody of them. I am here today to speak for the treatment providers constantly being squeezed for fewer and fewer insurance days for treatment. I am here for the lost, homeless men and women at winter's icy breath soon blow through the streets of Manchester, New Hampshire. As the holidays approach, and you are making your lists of who's naughty and who's nice, I pray your children will be spared from this plague, and that you never know what it's like to be me.
Mr. Griffin, thank you for your extraordinary testimony. And I can only tell you that for those of us who are sitting up here, that's why we're here too. And I can't thank you enough for putting a face and a voice and a spirit to the people that this epidemic takes and the people this epidemic leaves behind.
Thank you.
Thank you, sir, very, very much. Next, I want to turn to Jim Freund. Jim's from Ashburn, Virginia. We appreciate you being here, Jim, and taking the time to share your thoughts with us.
Thank you. Governor Christie, members of the commission, and invited guests, thank you for allowing my wife, Sybil, and me to be here today. We truly appreciate everything this commission is doing. This opioid epidemic has no boundaries, and I believe it is our nation's new 9/11. Our son Scott was a normal boy, growing up full of love, life for his family. When his brain started to misfire in 5th grade, not one doctor could really explain what was happening to Scott. Was it ADHD, bipolar, OCD, or something else? We tried everything. However, we never really found anything out. All the doctors did was start him on a journey of pill taking, which over time became an addiction to prescription painkillers. Scott's addiction changed his brain on psychological levels. It literally altered the way his brain worked by rewiring its fundamental structure. Addiction is a mental health issue, not a moral failing or a character flaw. We must end the stigma of addiction, as we are doing with HIV and cancer. During high school, we had to do an intervention for Scott, and we sent him to a wilderness program in the Utah desert. 9 months later, Scott then went into an aftercare transition center in Tucson, Arizona. 1 year later, Scott graduated from high school in a transition center. I remember to this day the wonderful graduation speech Scott gave, full of life, love, and appreciation to all those who had helped him. Scott was so appreciative of his recovery, he decided to become an on-site counselor, helping other youths who were suffering from addiction. Almost 3 years after Scott's intervention, Scott came home, and our family was back together again. We enjoyed doing things again, going on vacations, and just enjoying life as a family. 1 year later, or almost 4 years after his intervention, Scott took his own life on August 1st, 2010, just 2 days before his 21st birthday. He knew he was relapsing. It's crucial to realize and understand that relapse does not mean that the treatment has failed. It simply means the treatment plan needed to be readjusted. Our family is now exploring the possibility of opening a self-help, self-supported recovery home here in Northern Virginia. What this commission is doing in its final report to the President is readjusting our nation's response, focus, and solutions to this epidemic. In a letter Scott left behind, he wrote, I have not found one person who can help me out. He went on, I love you, Mom, Dad, and Ashley so much, and there's nothing you couldn't done better. I just can't stand being in my own mind. It's torture, and it hurts. And I've tried for years to get help, but nothing worked. Dad, if you can help other families from this torture I've been living with, it's you. It's now our life's mission to find solutions that will save other families from suffering like what Sybil our daughter Ashley, and I will endure it for the rest of our lives. This is why we are here today, to offer our support to this commission combating drug addiction. Our family is all in, and we want to help any way possible. We appreciate and thank all of you for what you have done, and your final report to the President has great recommendations and ideas. However, the real work is just beginning. We must educate, unite, and harness the power of the American people and the different groups and families that are out there fighting for solutions to this epidemic. Groups like the Office of National Drug Control Policy, Shatterproof, Fed Up, and the Addiction Policy Forum, just to name a few. The time is now that together all of us can make a difference and end this epidemic. Scott's final words to us were, "It's hard to stop typing now, but it's time." I love you so much, and don't forget that. And please don't forget me. We won't forget Scott, for he is ever in our hearts. We won't forget today as we all rise up together and begin the journey of conquering this epidemic. Thank you. God bless all of you, and we wish you all the best.
Jim, thank you very much. And I think your testimony is extraordinarily powerful on the fact that these issues coexist, these issues of mental health treatment and addiction, and that we need to make sure that those folks who are responsible for the care and treatment of our people, the medical community, the insurance community, understand that these two coexist, and that from your testimony, the reason for your son's passing was not his addiction. The reason for his passing was our inability to deal with his addiction and his mental health issues. And so it's a powerful, powerful reminder of why we continue to say that addiction is a disease and that there should not be stigma attached to it. And it is, it's been fascinating and frustrating to me over the course of working on this issue over the last number of years, the amount of resistance there still is in the public to people thinking that this is somehow a choice. For some people, it's no choice at all, as it sounds like it was for your son. And for others, it may have been one night of one bad decision. Or for the gentleman that Doug referenced, who just hurt himself and followed the doctor's instructions. I constantly bring these kind of examples up to people who say to me, "What are you doing? This is a choice," and they get what they deserve. This is one of the great fallacies that exists in our country regarding this right now, and we're, as individuals and as a commission, are simply not going to permit the stigma to continue to exist. One of the things that we recommend to the President, in fact, our first recommendation in this final report, is a extensive national media campaign paid for by the federal government with private sector partners that address two major issues. One, the issue of education so that people don't start in the first place. But secondly, and just as importantly, is the issue of stigma. And in New Jersey, that's what our public relations campaign, which we spent $25 million on last spring and another $25 million this fall, is focused on stigma and the fact that this can happen to anyone, and this is not a choice, and the result of what happens in their life is not what they deserve. In fact, it's not what any American deserves. And your testimony and Doug's have both been extraordinarily compelling in that regard. So I can't tell you as a father how much I feel for both of you and your families, and how brave I think both of you are, and that both of your children, I am confident, are extremely proud of what you're doing to try to make something valuable out of your loss. Thank you both very much. Next, I want to turn to Terry Alabaugh, the Community Impact Coordinator of the North Carolina Coalition to End Homelessness, We know that that has a lot to do, as Secretary Carson was saying before, the connection between addiction and homelessness. And Terry, we are very, very happy to have you here.
Thank you, Governor Christie, and members of the commission, as well as Governor Roy Cooper on the call, my home state governor. I appreciate the opportunity to say a few brief words to the commission here about drug addiction and facing the opioid crises. I've worked professionally for the last 30 years around the issues of homelessness and housing, addiction and recovery, as well as community planning and collaboration. I currently work with the North Carolina Coalition to End Homelessness, as well as the North Carolina Department of Military and Veterans Affairs as the Ending Veteran Homelessness Coordinator for the state. In the homelessness field, as you all have mentioned, which has lots of overlap with addiction and recovery, we've made substantial progress over the last 6 years working to implement best practices to address and end homelessness. From 2010 to 2016, there's been a 14% reduction in overall homelessness and a 47% in veteran homelessness across the nation. One critical component of this to improved outcomes has been the formation of richer collaborations between local housing and service providers and local leadership to establish goals, by name lists, coordinated systems of entry, and mutual lines of accountability. For example, one such collaboration to address veteran homelessness was spearheaded by the mayor of Fayetteville, North Carolina, and the director of the VA Medical Center located there. The collaboration achieved the goal of ending veteran homelessness in the fall of 2015, meeting the standards that have been established by the U.S. Interagency Council on Homelessness. They subsequently built upon this model and repurposed it toward a community response to address their opioid epidemic. One early intervention was to equip all police personnel with naloxone, a medication to reverse the effects of opioid overdose. In less than 9 months, 55 lives were saved in Fayetteville through this intervention. The availability of naloxone is one of the many places where my professional life intersects with my personal one. My oldest son, who turns 37 today, has been in and out of active addiction for nearly 20 years. And earlier this year, he relapsed, overdosed, and was revived with naloxone. For a teenager who was smart, artistic, engaging, and athletic, I could have not have imagined such a path for my son. It's a path that's included arrest and incarcerations, multiple stays in numerous detoxification programs, halfway houses, and outpatient treatment programs. It's also included both modest and lengthy times of sobriety and recovery, and at times, education, training, and employment. However, the elements of response to his situation never seemed to be connected in a comprehensive way that would lead to an integrated life of recovery, employment, and independent living. A relapse in May 2016 resulted in an occurrence of endocarditis, an infection of the bloodstream and heart valve, which came from the use of a dirty needle. He suffered a stroke and received a mitral heart valve replacement. He also suffered neurological impacts, which have adversely affected his cognitive processing skills and his executive functioning capacity. I know deeply the destructive power of addiction upon the individual, the family, and the community. I agonize over my response as a father who both desires to help my son and to hold him accountable. I am quick to heap praise upon those who offer their compassion and resources to help him, and also ready to voice my dismay over our fragmented system. To cite just one example of our disconnection, on a recent occasion, he was admitted in the detox unit after a relapse. While he was there, he had a high blood pressure reading, which for him is normal. Because the provider lacked sufficient access to medical personnel to allow clearance, he had to leave. He was dropped off at the local emergency room to wait and see a doctor for need clearance in order to be readmitted to detox. He did not have his blood pressure medication and waited 15 hours to see a doctor while his blood pressure rose, and it was in the proverbial catch-22 since he could not receive his medication at the hospital until he's seen by a doctor. When he did see the doctor, he was reminded that the ER can only treat high blood pressure when it's life-threatening, which it was not. The lack of resources and community coordination of existing ones leaves many seeking help to be in very vulnerable situations. It has taken a lot for my son's mother and brother to love, support, and help him piece together a system of care that offers hope. He's uninsured and does not meet the eligibility criteria for insurance through the Affordable Care Act. He has a disability application pending, but is currently not covered by Medicaid since North Carolina is not an expansion state. He's twice been refused his applications for Medicaid. I'm weary at times, yes, but then I ask myself and I ask you, how hard must it be for all those that do not have access to the kind of love and support that my son has had? How must it be every day that they face the world? Today, my son is living in an Oxford House, a peer-supported housing program for persons in recovery. He's attending 12-step meetings. He's working with vocational rehab to see if we can help him access needed vocational therapy and job placement. He's volunteering at a drop-in center and recently obtained his peer counseling training. He's making progress. Yet each day he's vulnerable to relapse and death. And this is the reality for all people who are impacted by opioid addiction. Today, however, he's alive and he's hopeful and he's with me here, and I'd like to ask my son Eli to please stand. I too applaud you, Eli, and the strength of those who rise each day to face their struggle. Let our communities find strength as well, and let us bring our political and social will to invest in evidence-based solutions and work together to create a coordinated response to this national crisis. Thank you, Governor.
Terry, thank you very much. Compelling words and actions. And I think as a number of people around this table have said today, it's not going to take, I think the Surgeon General said it the best, it's not going to take just the actions of government, it's going to take the actions of individual citizens to say that they've had enough and that they are willing to stand up and do what they can do to contribute to it. It doesn't relieve government of its responsibilities or its role, but it helps, I hope, to bring us to a successful conclusion much more quickly than it would otherwise. And nice move, by the way, too, waiting to the end to say Eli was here. It was very well done. You built the suspense, you got us right to the end, and then I know who that guy was sitting back there and that it's his birthday. It's truly a celebration for us, not only to have your testimony, but to have your son here, as I'm sure it's a celebration for you and your family.
I'm hoping that today provides him encouragement to stay in the course. So thank you for that opportunity.
We hope the same thing and pray that for you and for your family. Good going, Eli. Good to see you. Next, I want to turn to Justin Phillips. She is the founder and the executive director of Overdose Lifeline. She has done extraordinary work in the state of Indiana, and I got to be with her just this past Monday. I was there at the invitation of the Attorney General of Indiana to talk about the commission's work, and I was introduced to her by Congresswoman Susan Brooks, who is an old friend of mine from my days as a U.S. attorney, and Susan's as well. And when I heard of the extraordinary work that Justin was doing, I asked her if she would come here today and share it with the commission. And so I'm glad you're here, Justin. I'm glad you could make it to Washington. And I turn the microphone over to you.
Thank you so much, Governor Christie, and thank you for the invitation to be with the commission today. Your leadership truly has been an inspiration to me on my journey, and I appreciate that. And thank you to the rest of the commission for agreeing to take on this complex issue. As you are aware, Americans are suffering and losing a battle every day. My name is Justin Phillips, and I am the mother of 3 children, Brian, Aaron, and Audrey. Tragically, I'm here today with you because Aaron, at the young age of 20, overdosed on heroin and lost his life in October of 2013. My professional career was spent in preventing unintentional injuries and deaths, and I had a master's degree in nonprofit management. So when I became faced with this life-altering experience, I knew something had to be done. I'm now the founder and executive director of an Indiana-based nonprofit. We are dedicated to providing hope to families and, most importantly, eliminating the shame and stigma associated with the chronic disease of addiction. Some people will say I went to war, and I guess that's what I did, because I realized how little we knew about opioids and the large gaps that existed to address opioid use disorder. You see, Aaron grew up in a home with 2 parents in long-term recovery. I had 24 years of continuous recovery and knew nothing about opioids and prescription pain medicine. But Aaron knew about the family disease. He knew recovery was possible. He had stability. We ate dinner together every night, just like they suggest, even though he hated it and thought it was stupid. But he also had, some anxiety issues and numerous sports injuries. And I know he self-medicated. So when he told me he was struggling and could not quit on his own, I had no idea about overdose. I did not know about overdose reversal drugs, and I did not know of the likelihood of his death if he should relapse. And I didn't talk about it. I didn't ask for help. I didn't seek out the best treatment for him or treat him the way I would if he had been diagnosed with another disease because of shame and stigma and denial. And I know those things contributed to his death, and I don't say that to be mean to myself or take on extra guilt. I just know it's the truth. The day he went to treatment, I went to work. I wouldn't have gone to work had he been going to treatment for cancer. And I would have talked to you about it at my place of employment, and you would have brought me casseroles. But we don't do that for families who suffer from the disease of addiction. So I went to work to fill the gaps I discovered in awareness, information, prevention, and treatment. I like to call it my imperfect storm. I had the professional skills to prevent unintentional deaths, and I needed to prevent this from happening to others. I found subject matter experts to consult us, and I went back to school to become an addictions professional. Integrity and fidelity to the work we do at Overdose Lifeline is my key priority. This crisis is too serious for mistakes or misinformation. In 3 short years, we have accomplished a lot. Overdose Lifeline has developed the only youth awareness prevention program to address the dangers of opioids. Our program is now used in over 15 states. We are helping youth understand that the prescription they receive for a legitimate reason is also heroin in another form and very dangerous. We passed a law named after my son Aaron, allowing for over-the-counter naloxone, and we have trained and distributed over 13,000 Narcan kits to first responders and the public free through grant funding and private donations, and the help of our previous state health commissioner, Surgeon General Jerome Adams. Recently, we became the first organization in the U.S. to be trained in a new program for youth that teaches coping skills. We never talk to our kids about anxiety and what to do if we have anxiety. Last, we have effective, evidence-informed online courses addressing the opioid crisis. Aaron told me after he lost a friend in February, prior to his loss in October, Jake passed away, and I asked Aaron, okay, Aaron, can we go after the dealer now? And Aaron said, Mom, there's always going to be another dealer. So I decided for Overdose Lifeline that we would do our best to try and address the demand and stop the stream coming down. I worry about our state and the nation and the individuals who are now preying on desperate families in order to gain from this crisis. We need effective leaders such as yourselves to create effective guidelines and solutions to address this epidemic. We also need continued support of the grassroots efforts such as Overdose Lifeline. The work of the Commission and your report to the President will allow work like ours to have a bigger impact, and together we will save more lives than we are losing. Addiction needs to be treated like the other chronic diseases, so shame and stigma do not stop individuals and families from seeking help. Thank you so much for your dedication and your time today.
Justin, thank you for your incredible work in Indiana and the way you've affected the rest of the country. And thank you so much for your honesty today. It is incredibly refreshing to hear someone speak so honestly about the stigma, and to be able to put it into simple and direct words about what it's like to deal with it and what we're not doing for each other in this regard. And it's absolutely true. And so I'm really happy you could make it here today, and I thank you for you taking the time. I really do. Finally, I'm going to call on Vanessa Vitolo. She's the outreach coordinator for the Victory Bay Recovery Center in New Jersey. But also, I met Vanessa at a treatment center in Newark, New Jersey, where Vanessa had been fortunate enough to receive treatment as a heroin addict. And after having met her that day, I thought both in the way she spoke and the way she carried herself, that this was someone who could do as much or more about the issue of stigma that Justin just spoke about as anyone, for two reasons. One, because of the way, when I brought her here on the day the president signed the executive order establishing this commission, I went into the Oval Office before we went into the cabinet room for the meeting, and I said to the president, by the way, just so you know, I brought 2 addicts from New Jersey who are in recovery, and they're in the cabinet room, and you're going to get to hear from both of them, and they have a program for you, and you get to call on them. And he said, okay, great. And so when he got in there and sat down and we went through the preliminary discussions, he then said, where's Vanessa? And Vanessa raised her hand, and the president looked and he said, you? The power of Vanessa is the power that shows this happens to anyone and everyone. Whatever your stigmatized, predisposed, preconceived notion is of what someone who's struggling with addiction looks like, it's not Vanessa, but it is Vanessa. The second reason was that she was so extraordinarily willing to tell her story and to help for folks in New Jersey to get over that stigma. And so she is the star of the first $25 million ad campaign in New Jersey. There were lots of other people suggested, and when they asked me what I wanted, I said, I want her. And she has done that and has really become the face of recovery in the state of New Jersey. And I can't tell you how many people come to me when they talk about this and talk about her. And so I thought that the best way to end this set of testimonies to the commission for people who have been directly affected by this epidemic would be to end with Vanessa being able to make her remarks. So, my friend, I turn it over to you.
Thank you. I'd like to start off by saying I'm one of the lucky ones. Over 65,000 Americans lost their lives last year to this disease. But I'd like to remind everyone that these people aren't just numbers. They are our brothers, our sisters, our children, our parents, our neighbors, our friends, and our coworkers. My story is much like the 65,000 people who lost their lives, but by the grace of God, I am now in recovery from my disease. Like so many of them, I come from a good family in a small town. I grew up playing sports my whole life and was very, very close with my family. I went to a private high school and grew up cheerleading. I then went to college and joined a sorority. After college, I got a really great job, and I had an injury. Then I was prescribed opioid painkillers. At first, it seemed harmless, but it very quickly spiraled out of control. I was a full-blown heroin addict. Heroin is actually cheaper and more accessible. It had come to a point where I had given up everything for this drug. I'd isolated myself from my family and my friends, and I found myself jobless and homeless, selling my soul for the next high. Active addiction is a very dark place. I cannot convey the depths of my suffering and the suffering of my family. My mom used to drive around the streets of Atlantic City looking for me, begging people to find me. And the brief stints that I did see my mom, I would look her in the face and tell her, to accept the fact that I was going to die a drug addict. I would look my mother in the face and tell her to accept the fact that I was going to die a drug addict. I had myself accepted that fact that I was going to die for my disease, but I continued to use. If that's not a testament to how powerful this disease is, I don't know what is. I had reached a point in my life where I thought it was completely over. I had done too much damage, and there was no point of even trying to get better. I had tried a few times to get into treatment, but due to the fact that I only had Medicaid and the IMD exclusion, it was very difficult to get into treatment, and I would start using before I completed the process. Eventually, all the consequences to my addiction caught up to me, and I had found myself in jail for the 5th or 6th time. But this time, I wasn't getting out. My judge, Judge Sanson, fought for me to become a drug court participant. That action alone saved my life. Through drug court, I was sent to Integrity House, a long-term treatment program, where I also went to a halfway house and an intensive outpatient program. Integrity House taught me how to become a productive member of society again. Through the course of drug court, I got my license back, I got a car, I got my apartment, I got a job, and began my advocacy work for those who were still suffering, because I'll always remember, I'll actually never be able to forget the suffering that I had endured during my active addiction. I now participate in the Reach NJ campaign with Governor Christie. He started this to help people navigate their way into treatment, and it has saved thousands of lives. I'm so blessed to also be able to work for Victory Bay Recovery Center, where they fully support and believe in my advocacy work. They know that we have to treat the mind, the body, and the spirit. We believe the 3 keys to long-term sobriety are a good clinical plan, participation in the 12-step program, and structured sober living. Recovery is possible, and I'm living proof of that. 3 years ago today, I was sitting in jail, alone. And today, I'm sitting with all of you, participating in something that's truly amazing. My successes so far are what motivate me, and my own strength has inspired me. And if anyone is listening that's still suffering, that is the hope. My own strength has inspired me. My journey through recovery has been fueled by love and hope from my family and my friends. And my hope is to share that love and hope with anybody who will take it. I'm never going to give up fighting for the people who feel forgotten. I would like to take this opportunity to thank you all on the commission for their hard work and dedication. I'd also like to personally thank you, Governor Christie, for all that you do to save lives, not just on a national level or a state level, but on a personal level as well. Much thanks to everyone in this room and everyone working tirelessly on this issue. We have come so far, but I would be remiss to say if we didn't have a long way to go. We are all in this together. Thank you.
Thank you.
Vanessa, I appreciate it very much, and I think we can all see from listening carefully to their why even I could figure out that she was the right person to be the face and the voice of recovery at home and removing stigma in our state. And she's done an extraordinary job in doing that, not only through commercials that she's done on TV and on radio, but also by participating in the program across the state around meeting folks and talks. It's been really, really inspiring. Okay, so now what I'd like to do is to be able to turn to each one of the commissioners, my fellow commissioners, and let them make whatever remarks they would like to make before we have a vote on the final report. So let me first start with the author of the report. I want to also caution my fellow commissioners that, as usual, but I think thankfully, we've run over our time. For those people who are watching live stream, we're going to continue, but I want us to all keep in mind that our remarks should be more truncated than maybe we would have wanted them to be because of how far we've gone over, but I think we heard from the people that we really wanted to hear from today. Professor Madras has, as I announced at one of the previous meetings, was willing to be the main drafter of the final report. I can only tell you that the amount of effort that she has put in is indescribable. And the time and the effort and the inspiration that she has been to me, and I know to the other members of the commission. And so that's why I want her to begin her remarks today, and to all the people that she works with every day at Harvard, her colleagues, her superiors there. I want to thank them all for the support that they've given to her to let her be able to undertake this mission, because we couldn't have done it nearly as well without her. So, Bertha, I'll turn it over to you.
Thank you very much, Governor Christie and my fellow members of the Commission. I don't have prepared remarks, but first of all, I'd like to thank every one of you who testified. As a mother, as a grandmother, and as part of a loving family, it is unimaginable to me if this sordid and horrible course of events in your lives would have happened to myself. I fortunately escaped by the grace of God, but by no other means. So thank you very much. What you've shown all of us in this commission is that addiction is not only a brain disease, it's a family disease. There is no one in a member of the family that escapes the pain, the anguish, the torture, the suffering, and therefore we should call it also a family disease. There are two things I'd like to say very briefly. One is that if we don't stop the pipeline into substance use, if we don't promote prevention, we are going to have an open-ended catastrophe that goes on for multiple generations. And therefore, promoting prevention is critical. And every person who's in recovery and every family who has been affected by this needs to help us figure out, is there anything along the way that the system or you or someone could have done differently to avoid this? We need your input on that story as well. Secondly, and I'll conclude, I said I'd be brief, is that in looking at what is responsible for the specific cause of this opioid crisis, we have to remember that chemical coping and chemical reward is at the heart of this matter. And we have to find out how we can prevent it. What I did one night, Dr. Sally Sattel, a psychiatrist, emailed me at midnight, and she said, Bertha, I'm blaming the pharmacies and maybe the pharmaceutical companies. Who do you think is responsible for this? And at 1 a.m., I emailed her back and I said, Sally, my list is up to 12 and it's going to be higher than 21, and it now is. One of the things that we did as a commission is try to understand how we got here. What were the factors? What were the institutions, the societies, all the contributors, and try to reverse engineer and develop solutions that take into account how we got here. Some of them don't match at all, but many of them do. We have to correct the mistakes of the past, not only in solving this problem, but above all, in preventing it from happening again. Because if we don't learn lessons from the past, we are going to have a repeat and repeat and repeat for generations to come. And many of the lessons we've learned now are already beginning to rear their heads in terms of other substances. Thank you, Governor.
Thank you. We have Governor Baker on the line, and he is ready to speak and participate. We appreciate you, Charlie, being a participant all through the hearing today, and I want to turn to you for any remarks that you may have. Governor Baker.
Well, thanks very much, Governor Christie. Let me just start, first of all, by expressing my gratitude to the people who spoke today. Sometimes when you get into these conversations about clinical options and efficacy and all the rest, we miss the most important element of all, which is the heart and soul of what's at stake here, which is the people who are directly affected by this terrible illness. And I would just say very briefly that I look forward to continuing to pursue the implementation of the recommendations of the report. I think it's a great document, and I think it gives us a blueprint if we stay the course and persevere and recognize that we are dealing with a brutal beast who will stop at nothing on its own to be successful. And we need to follow through and be as aggressive as addiction is. And that, for us, I think, in many respects, will be our greatest challenge. We need to stay with this issue, stay committed to it, stay engaged in it, and put our shoulders collectively to the wheel to see it through. But again, I want to thank the people who spoke today for speaking and for bringing their heart as well as their minds to this conversation. It's such an important part of what people need to hear. Thank you.
Thank you, Governor Baker. Appreciate it very much. I then want to go to Governor Roy Cooper, the governor of North Carolina, who's also been with us by phone for the entire meeting today. And Roy, I invite you to make remarks as well. Thank you for your participation in the commission, and look forward to hearing your remarks. Governor Cooper.
Thank you, Governor Christie, and thank you for your leadership of this commission. I thank my fellow commission members, and particularly Bertha, who worked so hard on the drafting. Very powerful and gripping stories that were told today, and I think they're representative of hundreds of thousands of more stories across this country. Our first responders, our firefighters, police, they're on the front lines of this every day. To the many families who are suffering the pain of loss, some of who were spared. And because of the fact that this crisis is hurting our economy, we have to make sure that this good report involves real follow-through, as that is critical. This epidemic is unacceptable, and I am going to vote yes for this report. I may have to get off before we take the actual vote, so Governor, if you could record my vote as yes. But I urge the President and his cabinet and the Congress to enact these recommendations. I'll continue to do my part as governor of North Carolina, and I know the governors of this country are ready to step up and work with our local and federal partners to address this problem that is costing lives and costing our economy. So thanks again for the honor of participating with this, and now it's on to the follow-through. Thank you, Governor.
Well put, Governor Cooper. Appreciate it, and I think all of us up here are committed to the follow-through. And so we appreciate your remarks and appreciate your support. I next want to go to the Attorney General of the state of Florida, who has been a strong voice on this and a wonderful member of the commission as well, Attorney General Bondi.
Thank you, Governor, and thank you for chairing this incredible commission. As a career prosecutor, I don't have a personal story like many of you, other than when I was a young prosecutor, I watched a famous baseball player trade his World Series ring for one piece of crack. And that's when I learned the power of an addiction. And that has stayed with me my entire career. And I think I can speak for all of us, we don't sleep at night over this issue to this day. And when we start sleeping well at night, we're not doing our jobs. And for all of you families to come out and talk, and Mary, you've been my champion forever, for all of you to come out and speak on this issue means so much, and the world needs to hear you. Vanessa, Eli, to the lucky ones, and Justin, Jim, and Doug, I'm going to frame your children in my office. I frame pictures in my office to inspire me. Thank you. Thank you all for telling your stories and for what you do, because you keep all of us going. And that's what inspires people like Governor Christie. I know that every single day. So thank you all. You're changing lives. Thank you.
Thank you, Pam. Appreciate that very much. Next, I want to turn to Congressman Patrick Kennedy.
Thank you, Governor. What we need to do is keep the advocacy going. One of the reasons why this terrible tragedy has been allowed to continue is that there hasn't been the kind of voices that we heard today in this room all across this country, going to the attorneys general in this country, going to the insurance commissioners to make sure they write the insurance policies in each state, going to the state legislatures in addition to Capitol Hill. And it's taken us this long because this town doesn't react, nor does any other capital in this country, unless it hears from real people talk about their stories, and then follows it up by saying, and we're going to vote in the next election. That's how democracy works. And because these illnesses have been so stigmatized, the voices have been silenced, and the insurance companies are counting on it because it allows them to continue to practice more onerous medical management practices on those seeking treatment from addiction than they would in any other set of illnesses. And it still allows members of Congress to be, oh yeah, okay, I love to hear your story, and yet never appropriated the needed dollars in order to make a difference. So we need to take that, bully pulpit that the governor has given us today and saying, we're gonna make this happen because we need to go out there and start going to these officials and telling them that we're going to hold them accountable. God forbid, hold politicians accountable on an issue that's important to millions of American families on both sides of the political aisle. I want to thank Governor Christie for your incredible leadership throughout this process, including, from my vantage point, the work on the parity language, which was so crucial in this report, and I appreciate it so much, and your shout out for that. But as you know, parity won't matter if people don't have access to insurance. We need to get access to insurance, and with that, we will begin to treat the whole person because these aren't isolated illnesses. They have comorbidities, as we heard today. And frankly, it's going to cost the system less if we're to add up all the costs if we first provide them the coverage to begin with. And I'll just conclude by saying, in New Jersey alone, Governor Christie has led the way for over $200 million just this year, which marks nearly half of what the federal government is spending on this illness in just the state of New Jersey. If we're to extrapolate that, that would mean
your conference has been extended an additional 25 minutes.
Is that a New Jersey person? Or, I will say, if you extrapolate that across 50 states, that's a minimum of $10 billion that we need to spend on a national level. On the AIDS epidemic, we were spending $24 billion a year, and we had 53,000. Not to equate one life with the other, but let's just be honest. If we see those dollars appropriated there, there's no reason why we can't expect a similar amount of dollars being spent on this, our nation's epidemic for our time. And I thank the governor, and with that, when appropriate, would be happy to move the question.
Thank you, Congressman. I appreciate it very much. First, I want to thank the President for giving me the opportunity to chair this commission. It has been an extraordinary honor and eye-opening experience, and an experience that I will never forget. And so I want to thank him first for giving me the opportunity to do this and for caring enough about this issue to put it right at the forefront of his administration in his first year in office. There are a lot of competing interests in a first year of a president's term, and the fact that this president has made this such an important issue, I think, needs to be acknowledged, and I thank him for that. I also want to thank the fellow members of the commission. This is not one of those commissions where it was just like show up and get your name on a piece of paper. Everyone worked. Everyone, the final report that you see in front of you was contributed to by every member of this commission personally. Through this weekend, I was still receiving additions and edits and suggestions directly from members of this commission. That's an extraordinary thing for a Washington commission, I can tell you, to have the people who are sitting in these seats doing that work. So I want to thank all my fellow members of the commission, the ones who are sitting here, and Governors Baker and Cooper, who were here with us over the phone today, but have been at this table for every other meeting. I also want to thank our staffs, people who have been assisting us. This commission got great support from ONDCP, and I want to thank Rich Baum and his team, and we got great support from them and from folks in the White House. But I think we would all tell you that the individual members of our staff have been extraordinary in supporting this while they were doing the other jobs that they do for us as well. And I thank them very much, and most particularly my Chief of Staff, Amy Craddock, who has made this her work over the course of the last number of months. And she's been absolutely extraordinary with all the other members of the commission and continues to tolerate me, which is pretty good work. Let's just, as we get ready to give a final vote on the report, I think the testimony you heard today, and the reason that I decided to have the commission's last hearing be with all of you, is because I wanted those who are listening and those who will report on what happened here today to acknowledge that our people are dying. Our people are dying. 175 people a day, every day, are dying in the United States from this epidemic. I asked someone the other day who was talking to me about funding. I asked him if a terrorist organization was killing 175 Americans a day on American soil, what would you be willing to pay to make it stop? I think we'd be willing to do anything and everything to make it stop. And that's the way we now need to see this, because this is an attack from within. We are killing ourselves. And it is unacceptable, from my perspective, not to step up to the fight and do things, everything that needs to be done to stop the dying and stop the suffering. That doesn't mean just throwing money at the problem. It means, as I think Denny put very well, it means requiring accountability from everybody involved in this process to produce results. Just spending money won't be enough if we're not spending it in a way, as I think Justin put it, that's evidence-based. And you see that throughout the report, that we talk about evidence-based treatment that will help to give people hope and a pathway for them to deal with this enormous challenge. Been a lot of debate about the state of emergency that the president signed. Let me be clear here, the president did exactly what I asked him to do. I wanted this to be a public health emergency because I wanted HHS to take the lead in administering the funds, not FEMA. No offense to FEMA. They're fairly busy with some other things, and it's not their area of expertise. But now it's incumbent upon Congress to step up and put money in the Public Health Emergency Fund so the president can utilize that. And that should happen without delay in the view of the commission. I can't tell you how many members of Congress we had in this very room for a meeting who all said they were willing to do whatever made sense. Well, the commission is now handing, and the president is handing the baton to Congress. He cannot appropriate these funds by himself. The Constitution doesn't permit it. They must step up and work with him to appropriate the funds in the Public Health Emergency Fund and in other places that we suggest in this report to be able to do what needs to be done. You will see in the report that there are 56 additional recommendations that the report makes today. When added to the 9 recommendations in the interim report, that's 65 recommendations that we're making, all of which are substantive and intended to deal with specific issues that we have discovered through our work outside this room and also through the testimony that we've heard inside this room. We need to make sure that the National Institutes of Health work with our pharmaceutical industry to make sure that they do 2 things: to develop non-opioid painkillers and to develop more medication-assisted treatment for those who are already in addiction. It is inexcusable that the major pharmaceutical companies in this country have stood on the sidelines during this crisis. And they have. And that's why we called a meeting in Trenton that a number of people attended, and all of the major pharmaceutical companies attended, and they have committed to this partnership with the National Institutes of Health. We need them to follow through on that commitment. Those additional treatments, both medication-assisted treatment for addicts and pain treatment that's non-opioid will help to avoid many of the problems that you heard here today. We need more people to enter treatment, and to do that, we have to do two things: make treatment more broadly available, because right now only 10.5% of the young people and adults who need treatment receive that treatment. But we also need to remove the stigma, because we know that one of the reasons that people don't receive treatment is for the reasons that Justin put so eloquently in her remarks. The casseroles are not passed out. And I tell you, Justin, I use this story all the time about my own mother, who was an addict, who was addicted to nicotine, and who smoked from the time she was 16 years old until she was diagnosed with lung cancer at 71. And no one told me, when we let people know Mom had lung cancer, that she was getting what she deserved. She started smoking in 1948, but by 1964, from a Surgeon General's report, she knew that smoking could do her harm. And she continued to smoke for another 40 years after that. No one told me she was getting what she deserved. No one told me we shouldn't try to get her the best treatment in the world. No one told me that they weren't praying for her, because somehow it was a moral failing of hers to continue to smoke. In the very same way, I wonder whether I would have told people, if my mother was a heroin addict, that was her disease. I had no problem with telling them she had lung cancer and sharing that with people and getting the prayers and the visits and the casseroles. But I wonder if I'd done that if she was a heroin addict. I probably wouldn't have. And so the stigma is real. And it's not something that we just can talk about. It's something that we have to do something about each and every day. And your voices are the most important voices in all this. Because in you, in each and every one of you, every parent can see themselves, either because they've gone through it, or they know that there, but for the grace of God, they would go through it. And so we need you to continue to speak out and speak up and do what needs to be done. In the end, you can go through all these different recommendations, and I'm not going to now. But what I can tell you is that each one of those recommendations is being put forward thoughtfully and carefully and based upon real evidence that we believe that either this is a problem that needs to be addressed or it's an opportunity that we haven't taken advantage of. Now comes the much more difficult part, which is, as Governor Cooper said, the implementation of all of this. And there will be fits and starts, and there will be moments of impatience. I have no doubt about that. I've been involved in government for too long to believe that from here everything will go smoothly. It doesn't matter, who is running the government. There will always be certain moments when we won't get it exactly right, but we can't afford not to be working aggressively. And the thing that I admire the most about this president is that he doesn't fear action. And he does not countenance fear. He plows ahead. And I am confident that he will look, along with his administration, at these recommendations, that he will plow ahead and do things that need to be done, and that he will lead on this issue. When he asked me to do this, the only question I had for him is, are you serious? Because if you're not serious, I don't want to waste my time. And he looked right in the eye to me and said, you give me things to do and I will get them done. I believe this president will do that in this issue. And the last thing I'll say about that is this. I've known him and he's been my friend for 15 years. And so for 15 years, I've known the story of his older brother, that for one of the first times, and certainly in the most extensive language he's ever used, he spoke about last week. I've been encouraging him to do that for years, because I said to him when he gave me that pen last week and I walked up to thank him for that, I said, thank you, Mr. President. These folks now know that you're one of them. we have a person in the White House now who will not ignore this problem because he's lived it. And everybody up here on this dais has lived this problem in one way or another and is committed to it. And so this report and the interim report, I will continue to agitate and be impatient to see it get implemented. I'll continue to travel around the country, both as governor and in 76 days, not that I'm counting when I retire from the governorship, and continue to work hard on this issue because I care deeply about it personally and have for a very long time. So you all have contributed mightily to this, and I appreciate it very much. I want to thank Kellyanne again for being the person at the White House who understands this issue the most, who cares about this issue just as much as the president does, and who has worked extraordinarily hard to make sure that any hurdles that were placed in our direction were hurdles that we could get over. And so I appreciate that very much, Kellyanne. Thank you for being here and all the time you've committed to it. So I would entertain a motion from the commission to approve the final report.
Mr. Chairman, I move the final report.
I look for a second.
Second.
Thank you. And,
Second.
Thank you. And take vote. Professor Madras.
Yes, enthusiastically.
Congressman Kennedy.
Aye.
Governor Baker.
Yes.
Governor Cooper. Who I think already voted yes. Thank you, Governor. Attorney General Bondi.
Yes.
And Governor Christie votes yes, unanimous. We will convey this to the president immediately. It is up and available online. We invite you to comment on it. You have the ability to do that as well. I want to thank the folks at ONDCP for all the hard work in getting it going. Thank all of you for being here today. A very special and impactful day. Thank you all very much.